Hi, my name is Georgia Tetlow, and welcome to your session on mindfulness for chronic pain. Relieving chronic pain through mindfulness. I'll share these codes for your attendance and your session eval at the end of the session as well. So just give you a moment. Don't worry, I'll put them up again. I am a medical doctor. I did my residency at Jefferson. I graduated in physical medicine and rehabilitation residency in 2008. I did med school at UNC Chapel Hill. I am board certified in physical medicine and rehabilitation and integrative medicine. And I am a certified practitioner of the Institute for Functional Medicine. I founded my own clinic in 2009 on the main line, Philadelphia Integrative Medicine. I am a voluntary clinical assistant professor here in the rehab department at Jefferson. And I trained as a mindfulness-based stress reduction teacher at Jefferson in 2008, my last year of residency. And prior to med school, I was a yoga teacher and a one-on-one yoga therapist. Our agenda today is to understand what mindfulness is and how it affects pain levels and perception. We'll talk about how mindfulness practices lead to self-regulation of attention. That's so that the sensory, both the sensory and the affective components of chronic pain can be changed. Mindfulness teaches us how to separate our thoughts, which can be catastrophic thoughts, negative narrative about pain, from the actual physical sensations of pain. What is mindfulness? Mindfulness is voluntary. It's paying attention to the present moment, to the direct experience that we're having in this moment. And that means feelings, thoughts, sensations. So that is the direct human experience. That's the currency that we have to attend to. While we are being present, practicing being present, so you don't need to be present continuously, but while we hone the skill of returning more and more frequently and practicing becoming present in the present moment, we're bringing an attitude of non-judgmental, which means whatever it is that you notice about your direct experience, letting it be there and not struggling with it and trying to change it or push it away, no matter how painful or unpleasant or uncomfortable. So a non-judgmental attitude means that we don't put a label on the experience, and we certainly don't say that's good or that's bad. We don't have that narrative and those descriptors, those adjectives, other than just describing direct experience. So mindfulness-based stress reduction is the name of a program that was developed in 1979 at the University of Massachusetts. It was designed by a PhD, John Kabat-Zinn, and he designed it specifically for chronic pain patients. He put together a skills-based program, and he put it together in such a way, it's a codified program, it's has definite components, and the program is repeatable, testable, and it can be researched and has been researched extensively because it's been basically the same components since 1979. It's an 8-week experiential course. Some of you may have experienced it or parts of it. And it's once a week for a couple of hours. And then after about the 4th or 5th class, you might have a day of practice. It might be a 9 to 5, a 10 to 4, and you practice more continuously over a period of one day. So you finish and graduate from Mindfulness-Based Stress Reduction Foundational Program after 8 weeks. And you get some homework between sessions. So there's recordings from the cloud, and those recordings can go from a couple of minutes to 30 minutes. There are some programs that even do longer, like 45 minutes. And this training program is intended for patients as part of medical recommendation and a comprehensive treatment plan. And it's also for healthcare providers. It has an application for self-care and well-being for you and for healthcare providers in general. And anyone who can follow instructions can practice mindfulness. This is a little bit about how often we have published articles on the topic of mindfulness. This is a slide that I updated for you last week, and it's looking at how many publications in journals, journal publications on the topic. And it shows that we started checking in 1980, so a year after the program was developed, and we didn't have many publications until they started to go up in the early 2000s. And it's a hyperbolic, consistently increasing over time. And in 2019, there were over 1,200 annual mindfulness journal publications. And just to bring you even more up to date, this is what I find when I search clinicaltrials.gov. So you don't need to see the fine print. I realize this is not something you can focus on. It's too small font. But when I search, or when you search clinicaltrials.gov to see what research articles are in process, they've been registered, they may be recruiting, and actually when I looked up the search term mindfulness, so that means mindfulness needs to occur in the title of the article that's in process, I came up with 1,012 studies. So this is a screenshot of the first page. So there's 10 studies that are listed here. And I just wanted to give you a summary of some of the topics. And most of the studies that I found were actually completed. So that means they're in the process of being written up, or they're in peer review or in revision before they actually get off this list and go into published medical evidence. So you can see here on the left, there's completed. Many of these are actually finished with their enrollment and their recruitment phases. And they're not just active, they're actually completed studies. So what are some of these topics? In the first page, some of the research topics that are completed had to do with using mindfulness to improve adherence, so patients actually consistently taking their antihypertensive medication. There was mindfulness to address and improve emotional regulation, so mood balance, maternal mental health, and there was on the first page a mindfulness for medical students completed study, so that will be coming out. So if you've got 1,012 studies, so there's basically 100 pages, I just showed you one with 10 studies per page. So MBSR is practiced widely across the country and across the world. So it is often present at every major medical center. There's more than 700 major medical centers that offer the 8-week program, MBSR. As of 2015, 80% of medical schools were offering some kind of mindfulness training, not necessarily the 8-week full training program, but elements. The program is designed to be consistent, reproducible, and clinically relevant. And it has been shown to be clinically relevant for so many different ranges of symptoms, for medical symptoms, including psychological symptoms, blood sugar, response to vaccine. So there was a wonderful study that looked at hepatitis B vaccine titers in a control group versus a group that had just completed an 8-week mindfulness course. And the titers for the antibodies in the Hep B group, the ones that had practiced and trained in mindfulness, were significantly higher. So there are so many articles on so many topics, because also we can talk about this in Q&A. When you practice mindfulness, you help your nervous system, even if you have pain or a discomfort or a dysphoric experience, you help to transition your nervous system from a state of fight and flight and freeze into a parasympathetic state where you can learn, sleep, rest, digest. And when you transition more frequently and spend more time in that rest and digest state, there's so many clinical symptoms and so much physiology that is balanced and improved, including blood sugar, including the way that our neural networks work in our brain, including the many ways that we process pain. And there's just so many applications and improvements in the human body and in human health when you make that transition. And it doesn't mean you're permanently stay in rest and digest, but you start to practice and spend more time there. So mindfulness has been shown to actually reduce pain intensity. So that doesn't just mean that the narrative changes. It means that the way that patients report pain and the way that we study pain intensity in the medical literature is consistently reduced with MBSR interventions. And that reduction in pain is not short-term, it's long-term, it's years, up to 3 years. And it does matter if the participant is continuing to practice the mindfulness skill. Doesn't mean you have to do it perfectly. So how does this happen? How does mindfulness reduce the intensity of chronic pain? And it does this through acceptance and self-regulation. So let me explain. So one of the things that mindfulness does is it teaches us not to try to continue to avoid an aspect of direct experience, whether or not that's an unpleasant feeling or the fact that you're having unpleasant physical sensations. It teaches us how to allow those sensations to be there and for there to be less struggle with the direct experience, right? Less internal narrative, less conversation, less kind of rejecting of something that's present. It's actually, when you avoid your direct experience less, what you do is you're stopping that effort and other attempts to control pain. So pain is present, but you're no longer trying to control it as much. And what this means is that you have more energy and focus to actually redirect to activities where you can have an effect toward achievable goals. So one of the ways that pain intensity is reduced is through reducing our avoidance of direct experience. And it causes an increase in more valuable activities. That means things that you can actually, have an effect on, and that can improve your function. And you can experience less distress, less physical and psychological distress. So this is in contrast to medication. So when we take pain-reducing medications, we're really just trying to reduce the symptom, and that doesn't actually teach us how to fish. And of course, the medication is needed ongoingly. But in a mindfulness practice, actually, you can have an effect which incorporates the person's will, attention, attitude, and can have long-lasting effects. And you don't have to be dependent on a pharmaceutical or an intervention like that. So just to share this, there are some suggested mechanisms, and I'm going to go over some details here. So it's documented widely and consistently that pain levels go down. So how does this happen? The first way is our acceptance of our experience goes up. So that suggested mechanism doesn't necessarily mean that your pain perception changes. It just means that you accept things more. The second option is that if you have increased acceptance, sometimes that will actually lead to a behavior change. So you might actually behave differently. For example, what I just mentioned, put energy into activities which are more valuable, where you have you have an effect on the outcome, as opposed to things that are activities that are more fruitless and that don't actually cause you to feel better or to have an effect on your experience. So changes in behaviors lead to increased quality of life and to less pain. Now, the third way is listed here, and this is talking about how mindfulness can actually change your perception of pain. So there's a mindfulness intervention, and then this can actually help us to distinguish the cognitive and emotional aspects versus the physical sensation, because those are two different things. And when we do some more mindfulness practice, we'll be practicing that, just attending to is physical sensation versus the narrative and the thought about it or the feeling about it. Those are two separate things, and with time we can distinguish. So this actually change in self-regulation, which means that how we are sensing and perceiving pain can actually reduce pain intensity. It can feel like less pain and be less pain for the patient. And that can lead to improved quality of life and also lower reported pain scores. Any questions about that? Let's bring those up in Q&A. This is just another study I wanted to include, which is not about chronic pain. It's about mindfulness having an extraordinary effect, which I'm not aware of any other medical intervention that can actually cause this. So this is an older article from Lazar et al. In 2005, which looked at before and after just the size of different parts of your brain on a brain scan. And we're looking at control versus a group that completed an 8-week mindfulness training, just like MBSR. It was MBSR. And after the 8 weeks of training, the participants, and this has been repeated, the participants had a larger prefrontal cortex. So that's the executive center, as you know, of the brain, and proportionally more gray matter to a significant degree. So this was actually a significant change. Confidence interval was good. And the N, the number of participants. So this was a good study perspective. And in addition to actually changing the size of the prefrontal cortex, your brain was bigger. The helpful part, the part that is making decisions and balancing and using judgments and responding to the environment and to self. In addition, memory and motivation were improved. So all aspects of memory, including laying down memories and recalling memories. Let's do a brief experience together. And it's important to note that any experience you have when you start to become present is okay. So we'll be focusing on physical sensations of breathing. And it's completely normal for you to be focused on sensations and then to be distracted by some thought. It could be something that's happening in the future, or something in the past, or it could be a sound. And your attention can be drawn away from the focus of attention. And that is completely normal. You're still practicing mindfulness, even if you lose focus. And the idea is that as soon as you become aware, you gently bring yourself back to the focus of attention, so to the sensations of breathing. And so what will happen, and what happens for everyone, is that we have focus and then we lose that focus, and then we have the opportunity to come back. Lose focus, come back. Lose focus, come back. And with training and practice, we can actually be able to be present and unconditionally aware, or compassionately aware, or non-judgmentally aware more often. So when your attention wanders, it's important not to beat yourself up and to be critical and to have a whole conversation about where you just went and to get upset about. It's important just to come back as efficiently, as gently, with forgiveness, coming back to the breath in this case. If you can follow instructions, you can practice mindfulness. So that means that if you're in a coma or if you have a brain injury and you can't follow instructions, you might not be a candidate. If you have PTSD and you're actually flooding, meaning you have difficulty following instructions, or if following those instructions actually creates trauma or brings you back into a trauma state, those are times when you probably wouldn't want to practice mindfulness. Although many people who have PTSD who don't have such extreme flooding profoundly benefit from mindfulness training. And you can tell easily and use your clinical judgment about that. You can also do a brief practice and see how it goes, and you'll be able to assess that and the appropriateness of recommending an intervention for yourself and for your patient. Ultimately, the idea is to be able to attend to the sensations of breathing without actually changing the breath. Now, that might not happen the first times you try mindfulness. So you might notice when you pay attention to it, you actually just notice that you're controlling it. You're making it deeper, or you're counting it. So with time, it can become more possible to attend to the breathing and not change it. So we are breathing without having to think about it. It's an autonomic process. And when you bring your conscious attention to your breath and you don't change it, it's almost a sensation of being breathed, if you will. So you don't have to do anything. You are attending to your experience, you're noticing. So we have a focus of our attention, and you're just putting your focus in this place, but you don't need to do anything, and there's really nothing to do. And it's more of a transition from an activity or a doing activity to just being present. So let's try this together. I'm going to invite you to find your feet on the floor. So it's helpful to uncross your legs. And if you are on a chair that's too high for your feet to reach the floor, I'll encourage you to actually have your feet on the floor. It's helpful to have a stable base of support. So we sometimes talk about having some length in your spine and some alignment in your body, just on your head, over your shoulders, over your hips. And if you're turning your attention inward, sometimes it can be helpful to lower your gaze or to close your eyes, and that's optional. That's not necessary. And you can practice mindfulness through mindful walking, mindful driving. But it can be helpful when you're first practicing to lower your gaze or even to close your eyes. And beginning to become aware that you're breathing. Attending to the sensations of breathing. So, what it feels like in your body to breathe. You don't need to think about it, just feeling the sensations, the physical sensations. Just noticing if it's possible for you to just take a moment and direct your attention. Sometimes that's easy, sometimes that's hard. And what you're doing is you're just noticing if you can be present with your physical breath. And you don't need to attend to your breath perfectly. It's okay to go away and come back. It's also, sometimes it's not possible just to stay focused easily. It's okay. So letting go of anything to do. Just observing. You might notice a gentle expansion on the inhalation. And just a gentle contraction on the exhalation. So just without labeling it, just noticing the difference between inhale and exhale for you. Maybe feeling the inhalation of the breath through the nostrils if you're able to breathe through your nose. And we'll sit in silence for a minute or two and use this silent practice just to see if you can stay present. And if you notice that you wander, see if you can be gentle and almost efficient and just come back to your physical breath as many times as you need to. So gently coming back to your breath. And we'll get ready to complete our brief practice. So you can begin to deepen your breathing intentionally. And it might feel good to stretch your body. Often I'll stretch my arms or stretch my arms overhead, and I just naturally yawn after a little bit of practice. So transitioning back to our presentation, we're about to finish, and we'll have plenty of time for Q&A. So you can look online for mindfulness programs. Jefferson has the Myrna Brin Center for Mindfulness, which is a longstanding center, and that's the center that trained me to be a mindfulness teacher 12 years ago. The Penn Center for Stress Management is a well-established center in really every major academic center in Philadelphia and in most cities will have a program. There's a lot of online programs. There's a lot of in-person programs. There can be some programs that are free. And I also want to invite you to a monthly meeting that I lead, which is has a self-care focus, an experiential self-care experience. So there are some aspects of mindfulness that are included in that. That's not actually a mindfulness training. It's actually has mindfulness components. There's a meditation in the beginning and sometimes twice during that hour-and-a-half session the first Monday of the month. That's an online offering, so you can join from anywhere. And you are ongoingly invited to come to that. That's always free. And there are healthcare workers, doctors, nurses, medical staff, and integrated professionals that attend that. And that's been going on for almost 7 years. It's one of my favorite things to lead. It's not just talking about taking care of oneself. It's actually practicing that during that monthly group. And I hope to see you there. You can just go to my website and you can Philadelphia Integrative Medicine or my name, Georgia Tetlow, and you can just go to the events page and see what we're doing. We have free classes on integrative medicine topics as well. In conclusion, we've talked about understanding what mindfulness is and how it affects pain levels and perception. We've learned how mindfulness practices lead to self-regulation of attention so that sensory and affective components of chronic pain can be changed or modulated. We've also practiced how mindfulness can help us to separate our thoughts about pain from the physical sensations. And I want to provide the codes to you so you can make sure you got these, your attendance code, your session evaluation. And thank you so much. So our website, you can just Google the name of the clinic or my name or Philly-im as in mom.com is the website. So I've also included in your PowerPoint numerous pages of journal citations, and you can also read through these at your leisure, and you can see the many, many topics that are published for effects and outcomes related to mindfulness practice. It's really extensive. So this is the first page of the bibliography, second, third, fourth, fifth, sixth, seventh, 8th, 9th, 10th, 11th page of references. These are just some that I selected for you that I wanted to include. So let's go to Q&A. Thanks so much.